Hello everyone, welcome back to my channel guys. So today's topic is anti-arrhythmic drug. So as you know guys that there are four classes of anti-arrhythmic drug, that is class 1, class 2, class 3 and class 4. So today I will be discussing mainly the class 3 anti-arrhythmic drug. First of all, I'll talk about what is arrhythmia, then the what is its mechanism of action, then its clinical use and the side effect. So try to watch the entire video guys, as I have explained all the high yield information you should know regarding this topic. Okay, and guys, if my videos are helping you, then do like, share and subscribe. One more information guys, my next group tutor session for USMLE step 1 is starting from 4th September, and if you want to join the free demo session and see how the classes are held, then you are most welcome to join. The website and the contact details I'll mention in the description box. Okay, so coming back to this topic, what is arrhythmia? Arrhythmia is a condition where the heart is beating irregularly or there is an abnormal rhythm. So when we give anti-arrhythmic drug, that is going to stabilize the heart rhythm and prevents abnormal heartbeats. The drugs included in class 3 are amiodarone, ibutylide, dofetilide and sotalol. What is the mechanism of action? It increases the action potential duration. It increases the effective refractory period. So effective refractory period is where the sodium channels are inactive and there is no generation of new action potential. Okay, so there will be those are the phase 0, phase 1, phase 2 and some part of phase 3. So I'm going to explain that in the graph, and it increases the QT interval. As you can see guys that class 3 antiarrhythmic drug, it increases action potential, it increases the effective refractory period and increases the QT interval. So we are going to understand that in the graph. So before I discuss the class 3 antiarrhythmic drug on the action potential, let us understand the myocardial action potential. As you can see here that this is the cardiac myocyte and this is the intracellular and extracellular compartment, and there is phase 0, phase 1, phase 2 and phase 3, phase 4. What happens in phase 0? Phase 0 is a phase of depolarization and this is a repolarization. So during phase 0, the voltage gated sodium channels open. During phase 1, so where there is an inactivation of the sodium channel and potassium channel begins to open. In phase 2, there is calcium influx and potassium efflux will occur. Phase 3, where there is a massive efflux of potassium. This is a very high yield information you should know guys, that in which phase there is massive efflux of potassium, and that is phase 3. In phase 3, there is a closure of the voltage gated calcium channels. In phase 4, this is a resting potential where there is a high potassium permeability. Okay, since that we saw the myocardial action potential, let's see what happens when we give class 3 antiarrhythmic drug on the action potential. As you can see, this gray graph is the normal, right? And this blue graph is the effect of antiarrhythmic drug class 3. So as you can see, this action potential is prolonged here. You see here. So what is action potential? This is the phase where there is starting of the depolarization to the end of depolarization. You see, this is the duration. But after giving antiarrhythmic drug, look at this, it is prolonged, right? That's what we saw in the mechanism. And then you can see here effective refractory period. What did we see? The effective refractory period is phase 0, right? And then phase 1, phase 2 and part of phase 3. You see, this is also prolonged. And again, effective refractory period, here the sodium channels are inactive and no extra action potential is generated. Alright, so that is also prolonged. Now coming to the QT interval. So QT interval is, what is QT interval? So first of all, QRS is, and the EKG is a ventricular depolarization, right? QRS. So, and T wave is ventricular repolarization. So you can see this is the normal QT interval, and after giving class 3 antiarrhythmic drug, the QT interval is prolonged, right? So as you saw here guys, that everything is prolonged here, and now we understand that in the graph that the action potential, effective period, and QT interval is prolonged. And I'm sure that you did not, now will not have, you don't have to memorize it, you have understood the graph clearly. Okay, now coming to the clinical use, its class 3 antiarrhythmic drug are used in atrial fibrillation, atrial flutter, and ventricular tachycardia. And the high yield side effects of amiodarone is hepatotoxicity. That's why you have to do liver function test. And also it is important that amiodarone is 40% weight by iodine, so it can cause hypothyroidism or hyperthyroidism. That's why it is also important to do thyroid function test. Okay, and the next is it can cause pulmonary fibrosis, so that's again important to do the pulmonary function test. The other side effects of amiodarone is on the heart, it can cause heart block, congestive cardiac failure, and bradycardia. Okay, and the skin, it can cause blue-gray skin deposits, and that will lead to photodermatitis. It can also cause neurological side effects and constipation. The other class 3 antiarrhythmic drugs, that is sartolol and ibutylide, it can cause torsades. Okay, so I hope guys this short video helped you. And is there any specific topic you want me to make a video? Let me know. Thank you very much.